Hi friends, I am Dr. Pratap Nato. I have done MD in Pharmacy Medicine. In today's video, we will continue with inorganic non-metallic irritant poisons. In last video, we discussed of phosphorus. In this video, we'll start with iodine. So iodine, it occurs as a bluish black, soft and scaly crystals and as a metallic cluster and an unpleasant taste. It gives off violent color vapor with characteristic odor. It has a characteristic odor. Usually, in the purest form, it occurs as a bluish black to in the form of crystals with a metallic luster, and it is also has unpleasant taste. Action: it is a protoplasmic poison fixing the proteins and causing necrosis of tissue. Even vapors, if it is inhaled, it tears the respiratory passages. Coming to signs and symptoms, if the iodine vapors are inhaled, it causes glottic and pulmonary edema. Swallowed in sodium form, it acts as a corrosive poisons, and it will be the symptoms will be similar to corrosive poison like burning pain from throat to stomach, thirst, salivation, vomiting, purging, giddiness, cramps, convulsions, which may increase to limbs, conversion may lead to limbs and fainting. The lips and the angles of the mouth are also stained brown. The vomited matter and excreta are dark blue, yellow or blue in color, yellow is iodine stained, contains blood and have peculiar odor of iodine. Urine is scanty or suppressed or red brown in color. Fetal dose of iodine pure form is 2 to 4 grams. If tincture iodine is consumed, which is available in hospitals, it's about 30 to 60 ml. Fetal period is 24 hours. Treatment: it can be treated. First is the general management to remove the poison. Stomach wash is done, or emetics can be given. Stomach wash is usually done with warm water containing soluble starch, albumin, or activated salt can also be used, which combines with iodine to remove it. 1 to 5% solution of sodium thiosulfate is also used to convert tincture of iodine to harmless iodide. Sodium chloride will promote the excretion of iodide as chlorides compete with the iodide at the level of tubules, so it can be easily excreted and reduces the effect of iodism, which is a chronic poisoning of iodine. Symptom treatment is given like we can give alkalis, some arrowroot or barley water. Skin lesions can also be treated with about 20% of alcohol to remove any irritant effect of iodine. If the person dies post-mortem appearance, the mucosa of stomach intestines is inflamed, excruciating and may be brown. The heart, liver, kidneys may show fatty degeneration. There may be edema of the brain may also be seen. Chronic poisoning of iodine leads to iodism, so it may mainly occurs by chronic exposure to vapors of iodine. The symptoms are pain over the frontal sinus, running up nose, conjunctiva, and bronchial, mainly respiratory symptoms since inhalation of iodine vapors. Later on, there will be salivation, nausea, vomiting, purging, emaciation, lymphadenopathy. There may be parotid swelling, which is parotid swelling, we also call as iodide mumps, wasting of breast, testes, etc. And there may be acne or erythematous patches on the skin, urticaria, which is also called as ioderma. Coming to next poison is the chlorine. This is the again it's a non-metallic irritant poison. Chlorine is a greenish yellow gas and having an unpleasant irritant odor. It exposure to likely only in laboratories, bleaching powder industries, factories, other chemical works. It has an oxidizing agent action. It oxidizes and causes destruction of organic tissue. Signs symptoms: when inhaled, it has an irritant and suffocating effect. The symptoms of acute poisoning are intense irritation of eyes and throat and mucous membrane or respiratory passages, with violent coughing, extreme dyspnea, nausea, vomiting, and spasm glottis. So mainly inhalation of chlorine gas leads to respiratory symptoms, and chlorine not has a purest form. It means available as a cleaning agent as sodium hypochlorite is also available in household, which can be misused or accidentally consumed by children. Death is caused by cardiac failure following inflammatory edema of lungs and pulmonary congestion. Chronic inhalation is repeated small doses may give rise to chronic conditions like anemia, cachexia, dental caries, and progressive wasting. Fatal dose: exposure to 1 part in 1,000 may prove fatal in 5 minutes, so it acts very fast. And fatal period is up to within 2 days. It may last. Treatment: victim should be removed from the poisonous atmosphere. Shock, generalized treatment, succumb collapse, and pulmonary edema symptomatic treatment is provided. Post-mortem appearance: the symptoms are mainly the signs are mainly the asphyxial signs like cyanosis, particular hemorrhages are seen. There is inflammation of respiratory tract, pulmonary edema, rupture of alveolar walls, hemorrhages, and thrombosis of lungs. Increased viscosity of the blood may also be seen. Coming to mechanical irritant poisons. So these poisons, though are irritant, but they are not non-metallic or non-anything. They do not are absorbed also. So they mainly act as a because of their mechanical properties. So mechanical irritant poisons, they are not absorbed into the body, but they act mechanically and have only local actions. So wherever they are present, they act only, and it's not absorbed the body. They cause irritation of the gastrointestinal when swallowed. Some examples includes powdered glass, diamond powder, pins, needles, nails, chopped animal or vegetable hairs, all can also causes mechanical effects. Commonest among them is the powdered glass. So if the person consumes powdered glass, so fine powdered glass, if the person by mistake consumed, there is sharp burning pain in the throat, stomach, and intestine, nausea, vomiting, usually constipation, but rarely daily occurs. Death may result from shock if stomach or intestine is perforated. So because of powdered glass, if the gastrointestinal tract is teared or perforated, the person usually dies because of shock, because of internal bleeding. The fatal dose and fatal period is uncertain. It is not fixed, and it is not known to know the exact fatal dose. Treatment: usually bulky foods like demulcents, later emetics, and purgatives are given to remove any effects of gastric the powder glass. Though there is no specific treatment, only the powder glass should be removed from the stomach by any ways, like by giving bulky foods, so it should be evacuated. Postmortem appearance: erosions may be seen extending from mouth to upper part of the small intestine. Mucosa of stomach is covered with sticky mucus, and glass particles may be found in the stomach and intestines. The mucosa of gastrointestinal is congested and may be inflamed because of irritant effect of glass powder. Medical importance: it is rarely used as a suicidal or homicidal purposes. It is taken in powder form mixed with some articles or food for consumption for suicide purposes. Occasionally, it is also used as a kettle poison. These are my references. Thank you.